Hi, I'm Dr. Brett Snyder, and you're watching the Plastic Surgery Channel.
What I'd like to share with you is something we've been doing to help make skin shrink a little bit better, really enhance the results of liposuction using a technique called Thermage. It's really a nice option for those patients who have a little bit of skin laxity, not so much that they need a tummy tuck or a facelift, but enough that you're concerned that with the results of liposuction alone, it may not be quite ideal. I think most people know that liposuction is a good option for people who have those localized areas of fat that are resistant to change with diet and exercise. But the people who have a little bit of skin laxity are in a sort of special category where their results may not be as good, because when we do liposuction, we're counting on that skin to have enough elastic tone to be able to shrink down over the new contour and give you a smooth looking result. If the skin's a little bit loose, it's not going to shrink right, and it just may not look ideal. I think most people know also that if you have a lot of skin laxity, you're more likely to need something like a tummy tuck or a facelift. So the idea of being able to help these patients in that kind of in-between category is something plastic surgeons have been looking at for a long time, ways of helping that skin to shrink and be smoother. So we decided to look at the technique of Thermage with liposuction. Thermage has been around for several years. We decided to test the idea by doing actually a clinical trial. After we did the liposuction, we gave them a Thermage treatment only on one side. What we found was that we got about 30% more skin shrinkage on the Thermage side. So that's what we call a proof of concept study. We know that there's something real happening here. The skin is shrinking more when we apply the Thermage immediately after. So the next question then is, what's the ideal candidate for this? Really, where's the best application for it? I think one of the really nice options is for the neck and lower face area. Somebody who is not yet at the point where they would need a facelift, or it's even appropriate to think about that, but they've got a little bit of fat there, starting to see a little bit of loosening of the skin, and that's an area where we're seeing some really nice results. What I want to talk about also is the laser liposuction. It's a related idea. We did the first study looking at skin tightening to enhance the results of liposuction. We're now starting to see some reports from all these laser lipo procedures. These are all the brand name liposuction procedures. And they're coming forth with some data now that suggests that they can tighten skin too. And I think that's valuable to have all of these different options. The one thing that concerns me a little bit about this is that they're promoting it as an alternative to a tummy tuck or a facelift. And I think the more you do that, the more likely you are to have disappointed patients. I'm seeing patients in my practice already who knew that they should have had a tummy tuck. They were convinced that the laser liposuction would be a good alternative to that, and they're coming in now with scarring, lumpiness. It's a really difficult problem to go back and try to fix later. So I would suggest that anybody who's unsure about whether a tummy tuck is the right option or whether a laser lipo procedure is the best way to go, shop around a little bit. Talk to a plastic surgeon who does tummy tucks. Find out what that's really all about. Find out if that's the right thing for you. Really have a good idea of what you can expect from these different procedures before you make up your mind.